The headlines and advice about COVID are fluid, as we know, where we stand on a vaccine, what you can do to minimize your risk. So I want to bring in Dr. David Winter from Baylor Scott & White Health to help out with more of your great questions. Dr. Winter, good to see you.
Good to see you, Sonia. Glad to be here.
All right, let's start off with the questions I've been getting most this week. This whole deal around hydroxychloroquine. People are saying, why has this discussion resurfaced? Isn't this working for some patients? Are there really long-term health consequences? So can you clear this up for us?
Well, there's been 2 large observational studies, and there's been 4 randomized controlled studies. The last one came out, in fact, last Thursday, New England Journal of Medicine, the most prestigious journal in the country, in the world probably. All 4 studies and 2 observational studies say exactly the same thing. It doesn't work. I wish it did, but they can't find that it works. There are some significant side effects. The side effects are rare, by the way. They're not very common, but they can stop your heart. So big-time side effects. So the scientists and the physicians that I know and respect are not recommending these malaria drugs, hydroxychloroquine, known as Plaquenil, or chloroquine. Those 2 drugs are not recommended for the treatment of COVID-19.
Okay, so I've been talking a lot about vaccine production and distribution this week. Some things that I didn't get to, a couple of questions that people had. Do you think the vaccines will be mandatory? And also, do you think they'll become required for hospital workers and staff?
Well, mandatory masks in this country, in Texas, I don't think so. I think I can see them happening, though, in the hospitals. We have mandatory flu vaccines now. They make good sense for healthcare workers to protect the people they take care of. But I firmly agree, the more people get the vaccine, the more likely we'll get rid of this virus. If only a small proportion don't get it, that's a problem. Study came out a couple weeks ago, Sonia, you may have seen it, that 25% of Americans say, I will not take the vaccine. 31% said, I'm not sure. So we've got a problem with credibility here. We need to watch how these vaccines come out. Dr. Fauci says they will be working, they will be good. How long they last, we don't know. But if a lot of folks turn down the vaccine, we still have a problem with this virus.
You know, I heard from one viewer, Penny, who said, next to a vaccine, what do you think the best solution is for making life semi-normal again? She said, in my mind, Sonia, it's rapid testing. If there was a 2-minute breathalyzer that was affordable and accurate, there would be less symptomatic spread. Kids could go to school, parents could go to work, we could eat at our favorite restaurants. So what do you say about this? I mean, I know that the FDA has called on companies to start, rapid testing solutions, but where do we stand with that?
Totally agree. We need more testing. Right now at Baylor Scott & White Health, we don't have enough tests to take folks who don't have symptoms. If you have symptoms, we can test you, but we want to test more people than that. We don't have the capability right now. We need more testing. There's some tests on the horizon coming out. There's a spit test. The saliva they can test very rapidly for the virus. So far, it looks like it's probably good, maybe as good as the nasal swabs, but we're not sure about that. More testing to come. There's a point-of-care antigen test. Prick your finger, take blood from your arm. That gives a very good test for the antigen. It's only good in the first 5 days, though. After that, it's not very reliable. And the antibody test, just tell if you had it before. We don't know if that means you have immunity or not. So a lot of questions, but I totally agree. We need more testing of all kinds to get this safer, to get out and do the things we want to do.
And I guess before we get to a vaccine or before we get to any sort of rapid testing or real, solid information one way or the other on any of this stuff, we can wear a mask. I guess it was 2 days ago, I did a piece on how to effectively wear a mask because there were some studies that came out about the nasal cavity in particular and how the virus really likes to go in through the nose.
Yeah, I've got some mask here to emphasize what you're talking about. The point of a mask is that you breathe through the mask and not around the sides. This actually is an N95 mask, and these ideally are fitted to you. We have some actually fitting experts, so if you put this on, no air gets around it at all. So this is the ideal, and these are very expensive and in short supply. So these cone masks, these are the same idea, and if you wear it tightly, this can work well. And then the common one, these are the ones that the doctors wear a lot and the nurses do. These work as long as you make sure they fit well and don't leak around the sides. But for that matter, a cloth mask can do the same thing, as long as it doesn't leak around the sides. Even a bandana is probably the least effective because you can get some leakage. But I want to emphasize any kind of mask is a good mask. So pick your mask, try to make sure there's no leakage around the side. That's the way you prevent spreading and contracting the virus.
All right, Dr. Winter, we certainly appreciate your time as always.